So today we'll be talking about chronic anal fissures. What are chronic anal fissures? These are basically breaks in the anorectal skin, typically below the dentate line. And what is this dentate line? It's to put it simply, let's talk about it in terms of hemorrhoids. Hemorrhoids always start off internally, and typically they start off above the dentate line. And then external hemorrhoids, once the internal hemorrhoids get pretty bad, it starts getting bigger and bigger and bigger. It crosses that dentate line, and then you have external hemorrhoids and or skin tags. Now, anything above this line, there are no open nerve endings. So any kind of trauma, any kind of break in the skin tend to just cause painless trauma, so like painless bleeding from internal hemorrhoids. Below this line, there are open nerve endings. And that's the reason why we don't ban grade 4 hemorrhoids or bad grade 3 hemorrhoids, because it'll be very, very painful. Because again, below this line, there are open nerve endings. Fissures tend to be below this dentate line, so they are very, very painful. To kind of show you how fissures work, pretend this is a break in the skin. Now, clench your fist. If you look at your fist, I'm not sure if you can see well on the camera, but if you clench your fist, you see there are areas where it's so pale. There's not enough blood flow. So you have a break in the skin, and you have a very spastic muscle, or muscles that go into spasm and is very tight, and blood flow isn't able to occur. So how can it heal itself? It can't. And that's why chronic anal fissures are exactly that, chronic. Because it's very difficult to heal in that kind of environment. So with that said, the treatment options for chronic anal fissures attempts to relax that area. And there's usually a step up in the treatment from less invasive to most invasive. So what's the typical first line treatment? These are creams that you insert or should be inserting at least 2 to 3 centimeters inside the rectum. And then you apply this twice a day. In our clinic, we typically ask patients to use it for at least 6 months. Patients usually only start to feel better after 2 to 3 months. So it's a long patient wait, even with the creams. Now, if you continue to have symptoms on the 3rd to 6 months, or you have worsening symptoms, then maybe that's not enough for you. And we go to the next line treatment. And there's 2 of them. One is surgery, where we burn off the anal fissure with cautery, and we call that fissurectomy. The other one is Botox. Now, Botox works the same way in that it helps relax that area, but its onset of action is a lot faster. Patients usually start to feel the difference after about a couple of weeks, and then the Botox itself lasts for about 6 months. So you may be asking, why don't we give Botox at the onset? Now, the reason for that is the butt is a dirty area. And Botox injection is an injection. So imagine, let's say this is your butt, and it's dirty even if you try to clean it. And then you inject something. If there's bacteria in that area that hasn't been cleaned well, and you inject something, there's a possibility for that bacteria to be introduced inside the skin or the mucosa. And then you can have an anitis of infection there, and that can cause an abscess, and it can also cause a fistula, which is a tract under the skin, and that's a bigger problem than having fissures. Now, again, this is a rare complication, but because of that, we don't like using Botox at the onset. Now, if these 3 methods don't work, the cream, the Botox, the fissurectomy, the last resort is something called a lateral internal sphincterotomy, which is an even more invasive procedure where we literally have to cut off the anal sphincter. Now, the internal anal sphincter is attached to the external anal sphincter. We typically cut the connection of the internal to the outer anal sphincter, and that allows more space for the muscle to expand. And with more space for the muscle to expand, your anus can relax more, and then blood flow can occur, and then your body can heal itself. So that's the deal with chronic anal fissures.